What's up, everyone? Dr. Chad Schaefer PT here in Metro Detroit. I always put videos up about success stories, cool stuff like that. This is nothing like that. This is a cool story about a patient I just saw in relation to evaluation and what she was dealing with. So she came in with some left lower back pain, history of sciatica, chronic history for the last couple of years. She was unsure if the two were related. Actually, she was kind of dead set that they weren't related, but most likely they do have some sort of a connection. But the reason I want to make this video is because we're trying to identify where the source of her pain is at. Is it her lower back? Is it her hip? Is it her SI joint? So again, this is not a success story, but this is just a quick snippet about where the symptoms are coming from. So often I see a lot of people are, kind of quote-unquote misdiagnosed, where they've been treated for their lower back tons and tons of times, and turns out that it's actually the SI joint or it's the hip that's giving them the problem. So in this patient's case, it's sounding like she's having an SI joint problem. So a lot of the patients that I work with, I'm examining them with a movement-based evaluation, meaning looking for pain and symptoms with repeated motion. And that's going to tell me two things. It's going to tell me, one, is this a mechanical problem, meaning are you appropriate for physical therapy care, or do you need to be referred? That's the biggest thing if you go to get treated or seek help, is work with someone that's really going to be able to figure out or use some tests and measures to really know, are you even appropriate to be here? So if someone's coming in and saying, man, I've got constant pain, movements, positions, exercise really don't change my symptoms, and they're constant all the time, and honestly, that sounds like kind of like a red flag, meaning that you probably should be referred to your doctor. In this patient's case, she had what it seems like SI joint problems, and I'm going to give you a little bit of a history or background about SI joint problems. So in the patient's history, the person sitting in front of you, they're going to tell you most likely what you want to do next, meaning they're going to tell you a background, a history, a little story of their symptoms, how they react, how they feel with certain things, and then you're going to test those things with a hypothesis in your head. So in this patient's case, she had left side SI joint problems. It was unilateral on the left side. It never crossed the midline, with lower back, mechanical lower back pain that tends to kind of move and shift side to side. It's kind of variable. SI joint pain typically stays on one side. The other kind of key snippet, or the clinical pearl as we call it, is that the symptoms that she was having didn't go past the ankle. A lot of the people that have lower back problems and they have the sciatica, typical sciatica, either have pain down the leg, and a lot of the times if it's all the way down to the ankle, it even goes to the foot as well. The other thing was that she didn't have any numbness or tingling in her episodes of sciatica. Well, right now, she does have some leg pain, but no actual numbness with it. So those are some differentiating factors. So if you're dealing with SI joint pain or lower back pain, or just pain down hip area somewhere and you're not really sure, listen to those snippets that I gave you again, and then find something that's going to help you. Thanks for watching.